Dr. Calhoun, thank you so much for joining us here on Health Connection. Our topic, UT Health Northeast and MD Anderson Cancer Center, a new partnership, a very, very big day and a big event here happening at UT Health Northeast. Tell us about the collaboration with MD Anderson and tell us what changes will be coming to UT Health Northeast Cancer Treatment and Prevention Center. What's going to happen?
Well, thank you so much for asking about this because this is a big deal. This is a big deal for our campus. It is a big deal for our community. It is a big deal for individuals who may develop cancer, who will require cancer treatment, and for cancer survivors, because survivorship is a very important piece of this, and perhaps we can explore that a little bit later. But what it's going to mean is that the number one cancer center in the world is going to be partnering with UT Health Northeast to improve cancer prevention, cancer diagnosis and treatment, and cancer control management across an entire community, and improve survivorship. You know, individuals develop cancer, they are treated. We have to follow them to make sure that there are not recurrences of their old cancer or recurrences of new cancers. That's a problem in individuals who develop cancer. And so having a very robust survivorship program along with really good diagnostics and really good clinical care is going to be very important.
The legacy of this institution is pulmonary disease, treating lungs. And one of the things that we know about East Texas is that in this area, people smoke more than in other parts of the state and other parts of the country. Talk to us about the tobacco use in this part of the world and what it means in terms of developing lung cancer.
Well, tobacco use is a terrible problem. And people who live in Northeast Texas have a habit of using tobacco. And it plays a very, very prominent role in lung cancer. That's not disputed anymore at all. Smokers have a much higher incidence of lung cancer. And I know people tell stories, they'll say, well, he's smoked all his life and he's lived to be 90. Well, that's one smoker out of maybe 10. The other 9 died at 40 from lung cancer.
Right.
So you know, you can always find an outlier, and we don't know why those individuals can do it and not get lung cancer. But we do know that you can take most people and expose them to cigarette smoke, and their chances of developing lung cancer just go up tremendously. Moreover, you know, tobacco has been implicated in a number of other cancers, kidney cancer, bladder cancer, so on and so forth. We know that people who chew tobacco can develop cancer of the mouth and the throat and the gums and so forth. So it's a big problem, and it's a big problem in East Texas. And figuring out how we can make sure that youngsters growing up do not develop smoking habits, and limiting those young people's exposure to secondhand smoke, and helping smokers who live in our community kick the habit is an important piece of cancer prevention.
Cancer cases overall, how many cancer cases are there here in East Texas, and what kind of mortality rates are we dealing with?
Well, when we talk about cancer, we don't just say cancer. Cancer is a very complex disease. Lung cancer is not the same as prostate cancer. It's not the same as colon cancer. And so there are some cancers that are much more prominent than the state average in Northeast Texas. We know, again, because of cigarette smoking, we have a much higher incidence of lung cancer. And you mentioned our UT Health Northeast long history in lung disease. We've treated lung cancer for a very long time, and we have a very good experience with that. And we're going to be adding our data and our knowledge about lung cancer to the great work that's being done down at MD Anderson. We know that prostate cancer runs a much higher incidence in Northeast Texas. Well, Northeast Texas, percentage-wise, has a higher number of African Americans than some other parts of rural Texas. And prostate cancer is more of a problem in African American males than it is in white males. There's a higher incidence there. So, you have to almost look at it cancer by cancer. We clearly know that lung cancer, prostate cancer, bladder cancers, those sorts of things are more prominent in our area. Breast cancer, maybe a little bit less so, a problem, but less than the state average. So part of what this new relationship is going to bring is that those MD Anderson scientists are going to be working with researchers and scientists in our new school of community and rural health with these public health researchers to really dig into East Texas, understand what our true cancer incidence is, and which cancers we need to be focusing on the most.
According to data that we have, about 1 out of 2 patients diagnosed with cancer in this area are leaving Northeast Texas to go somewhere else to get their care. How does this collaboration with MD Anderson change that?
It is not uncommon for me to receive a couple of calls a week from people in the community who are seeking care at an MD Anderson or a UT Southwestern in Dallas or other prominent cancer treatment center in Texas. Texas is blessed in a way in that Texas has 4 NCI designated cancer centers. NCI stands for National Cancer Institute. These are the best places in the world. 3 of them belong to the University of Texas. So University of Texas is really great in cancer. Those 3 are the Health Science Center in San Antonio, UT Southwestern in Dallas, and of course, the leader of us all, UT MD Anderson Cancer Center in Houston. The Baylor facility in Houston is also a NCI designated center. So those are the 4 in Texas. Interestingly enough, to have that NCI designation, they have to show that they do reach out to other communities. And for a very long time, we have had a relationship, a clinical relationship with Anderson. We continue to have one with UT Southwestern as part of an NCI designated center. This new relationship with Anderson is going to bring us much more into that fold and ensure that patients who are getting medical care at the UT Health Northeast MD Anderson Cancer Center are getting the kind of care they would receive if they were to go to a National Cancer Institute designated cancer center. We're going to bring that quality of care here, that kind of recognition to our community.
So just to translate that to patient benefit, that means get up out of your own bed at your own home, come and get your treatment, and go back home and sleep in your own bed rather than go to Houston, sleep in a hotel. This collaboration reduces the need to leave the community.
Right. So if you want to make sure that the care that you are receiving meets the highest standards of the National Cancer Institute, that is the most advanced, and very importantly, if you are a candidate for a clinical trial, and we should talk about clinical trials in a minute, but if you're a candidate for a clinical trial, that you are going to be participating in something that is based on the latest technology available and the latest information available. The kind of thing that maybe has not been shared with the general medical community yet, but is being performed by the very best cancer centers in the world.
But right here in Northeast Texas.
But we'll do it right here in East Texas.
That's significant. You brought it up, let's go with it. Clinical trials. Let's first of all get a definition of a clinical trial.
Sure.
And then how does that apply to treating cancer?
There is this huge battle that's taking place to find the newest and most modern treatments for cancer. And as I said earlier, no one cancer is the same. Ironically, not every lung cancer, for instance, is the same. There are many kinds of lung cancers. It sort of depends on what stage of the lung cancer you're in. And really based on that data, even laboratory data, we now can actually take the cancer cells, extract them, identify the genetics of that cancer, which may vary from time to time, and customize the treatment that will be most effective. That's being done at places like MD Anderson. It'll be done here. A lot of that work, will be sent from here. It'll go down to Anderson. Will be on a common record. That information will come back to our doctors here. When we have a new drug that we believe, we the medical profession, believe will be effective, more effective than what we have right now against a particular cancer, before that's allowed to be shared with doctors all over the country, they allow the expert centers, the MD Andersons and their affiliates, to get access to that drug and try that drug and see how it works in a much larger number of patients. When I was talking with Dr. Ron DePino, the president of MD Anderson, he told me that the most important thing he wanted out of this relationship was that he wanted patients in Northeast Texas to have an opportunity to participate, should they choose, in these clinical trials and get what we believe may be the most advanced drugs or radiation treatment or devices to address the type of cancer they may have.
So from the patient's perspective, a clinical trial gives them access to treatments that aren't generally available.
That are not generally available to others.
And from the institution's perspective, you get real world data on how well a treatment is working.
That's right. That's exactly right. We get that data, we get that information. We can compare how that patient who is now participating in the clinical trial, how those patients are doing to patients who are getting the older stuff.
Right.
And, if we find that the results are the same, then you don't go to the expense and the challenge of bringing on a new one. But, as is the case not uncommonly, we discover that those drugs are better, that they are a more successful cure, and that the cures last longer, or they occur more rapidly, or they occur with fewer side effects. All these things have to be looked at. And these are the types of trials that come to the most advanced centers in the world, like Anderson and Anderson's affiliates.
As you mentioned, UT Health Northeast and MD Anderson Cancer Center in Houston are both a part of the University of Texas system. So is this collaboration new, or are we building on an existing relationship?
We're very much building on an existing relationship. Some may not realize, but some of the very first cancer work in Northeast Texas was done here at the University of Texas.
Tell us how.
Well, actually, cancer work really began here in the 60s, and went on through the 70s, and then it declined. Some of the practitioners went into private practice. They left the university. We lost a little bit of our cancer focus at that time. And when I came along as president in 2002, one of the challenges we had before us was how were we going to readdress cancer on our campus. There was even a more important question. Should we we address it? Or was it adequately being done in the community? Because we have some excellent cancer providers in our community. You know, they do a great job, and they serve a large number of people. And so we studied it. Now, it was ironic that we had the cancer data was being collected by our campus and turned into the state. We had a contract with the health department to collect that data. So we had that data readily available. And that's where we were able to identify that probably because of transportation issues, some cultural issues, and for other reasons, we had a higher cancer mortality than the state average. We had these pockets of cancers that occurred more frequently in our community. And we discovered that data that showed that over half, nearly half, over half, just slightly over half of patients who were diagnosed with cancer were choosing to go to a Houston or a Dallas or to leave our area for cancer care. That told us that more could be done in our community. And we felt we had an obligation to help plug that gap. I had a discussion with the then president of MD Anderson, Dr. Mendelson, and he said that from their data at Anderson, we were absolutely right. We needed to do more. We needed to have enhanced radiation therapy, and we needed to build a cancer center that could do some significant work. And with his help, and we got the permission of the Board of Regents, and we moved forward on our cancer center. So if you come into our cancer center, you'll see a plaque on the wall thanking MD Anderson. They helped us design our cancer center here. They helped us staff it. More than half the personnel here are people who were trained at MD Anderson. Even with all that, to have the MD Anderson brand more closely associated with us, we had to demonstrate to them that we performed at a very high level. And it's taken the last 5 years to gather all that data, that information. Our patients come from 193 cities in Texas, 52 counties. They come from 16 states. You know, all that data, our success rates, our survivorship programs, our behavioral health programs to help cancer patients, all that has been assessed. And they came back with a few recommendations, which we're implementing, and the opportunity to become one of their partners here in the U.S.
UT Health Northeast, MD Anderson, what does each institution bring to this new partnership?
Let me start off by talking about what we're going to bring to the relationship. This is my pride coming out, and Dr. DePino was very complimentary of us in his remarks, that even though we're one of the smaller UT academic medical centers, we are recognized as being a very well-run academic campus. I'm proud of that. I'm proud of the team I have that help me do that every day. That most patients don't wake up in the morning and say, gosh, I have cancer. I need to go get care at MD Anderson Cancer Center. They wake up with a cough, or they see a lesion on their skin, or there's pain somewhere, or there's blood in their stool. And they go see their primary care doctor. So one of the first aspects of cancer care is not the oncologist or the radiation therapist or any of that. It's an interaction between you and your primary care doctor. Well, we train primary care doctors for Northeast Texas. That's our mission, our primary mission in life. And so there's this relationship between primary care, how primary care doctors are trained, how they interact with oncologists when they have patients with cancer. Cancer's a common problem. 1 out of every 2 men, there are 2 of us sitting here, one of us will have cancer, statistically, and we'll have to get it dealt with. But 1 out of every 2 men, 1 out of every 3 women. So this is a primary care problem, and we bring tremendous primary care strength to what MD Anderson has to do as a tertiary specialty center. I mentioned behavioral health earlier. You know, to be told you have cancer, you would be an abnormal human being if you were not depressed, if you were told you had cancer. I mean, it is natural. You know, just going through the chemotherapy, the radiation therapy, the loss of hair, you know, all these kinds of things that can occur associated with cancer. We have a very strong behavioral health department here now. And they're going to be working very closely with the cancer people, both here and at MD Anderson, to identify new ways, better ways to help patients and families cope with this very scary diagnosis. And then thirdly, going back to how do we do prevention, how do we do cancer control, how do we do survivorship? And my passion over the last couple of years has been public health. How do we keep people healthy? You know, how do we keep people out of the hospital? We're very focused on keeping patients out of our hospital. You know, we're not a private hospital that is focused on generating our revenue that way. We're an agency of the state of Texas. Our job is to keep Texans healthy. Right. That's what I go back to the legislature and brag about, that we're keeping Texans healthy. Well, 50% of all cancer, I'll shock you with this, 50% of all cancer is preventable. You know, you stop people from smoking. You you get your colon cancer screening done. You manage sun exposure on your skin. You prevent obesity. We know obesity is associated with the development of certain cancers, breast cancers and other cancers. You know, these are the things we know. There's a whole ton of things we don't know yet about how do you prevent cancer. What kind of environmental exposures put you at greater risk of cancer? Cancer public health is going to be the wave of the future. How do we prevent half of all cancer in the United States just by how we change and manage lifestyle and the environment we live in? So we have tremendous strength there, particularly in smaller and rural communities. MD Anderson's really good at figuring these things out in Houston, but life in Houston and life in Tyler or Mineola or anywhere else in an area like ours, life is very different. Mm-hmm. And so Anderson wants that data. They want to know about people who live, you know, not just in the great metropolitan areas of Texas, but Texas is one of the largest rural states. It's one of the larger frontier states even, where places where there are more cows than people. And, you know, we need to figure out how we're going to manage cancer for all populations. So that's what we're going to bring to MD Anderson. What MD Anderson brings to us is obvious. You know, their expertise in the treatment of cancer. We'll be following their cancer protocols, their exposure to their clinical trials, the fact that the people we hire here are going to be people who have been vetted, who would just as easily be hired to be working as faculty members or staff people at MD Anderson. Our first task now is for MD Anderson and Health Science Center Tyler, UT Health Northeast, to jointly recruit a cancer center director to run this operation here. And that's going to be someone who is fully vetted and fully acceptable to MD Anderson as well as ourselves.
We have here at UT Health Northeast the Cancer Treatment and Prevention Center, where it is almost literally true the paint still smells new. It's a recently completed facility and it is technologically current. So how will this partnership change? What will be different going forward in this brand new facility?
You know, it is a great facility. We have people who are visiting our facility. It's been identified as a Varian Center of Excellence. That won't mean a lot to the public, but to to people who work in the field. They know how important that is. And because of that, we have people who come and visit our center from around the world. And you may say, why? Well, they'll go and they'll visit an MD Anderson Cancer Center in Houston. You've probably been there. Mm-hmm. It's a gigantic place. They go see that, and everyone is overwhelmed at just how fabulous it is. But they also walk away saying, we cannot have this in our community. We don't have the resources. And so what we've done here is taken some of the best of what they have there, recreated it here, and recreated it in a fashion that can be duplicated in many communities. And because of that, we've had not only visitors from all over the United States, but we've had visitors from Brazil, from Israel, from Britain. And in fact, in Brazil, there are several community cancer centers that are set up on the UT Health Northeast model. I wish I could have put a patent on it, but I didn't. And we're academic anyway, so we share our information with anyone who's interested. So we have really a state-of-the-art facility, best technology, laid out in a way that is focused around the patient primarily. And in fact, some of the visitors here from MD Anderson have said, now we know how we may want to do it if we extend out to some of the smaller communities in and around Houston.
The timeline for all of this. What are some of the first changes that people will notice here?
There'll be a new sign on the door,
okay.
of course. The new piece will be really in the additional people, some of the great people that we are going to be able to recruit. I'm not sure the public understands when you're going out and you're trying to recruit a doctor to come to a community, how challenging that may be. And we do a pretty good job of recruiting good people. But, imagine that you're interested in a job, and the letter that comes to you about that job not only says UT Health Northeast, but it says MD Anderson Cancer Center.
Right.
What you may believe that's going to do for your career.
Right.
In fact, I know what it will do for their career. And so some of those people who are just some of the best folks around, who may have been reluctant to come to a smaller community, will now entertain coming and working here at our facility because they are going to be associated for the rest of their career with the #1 cancer center in the world. That's a very powerful recruiting tool. And it is going to allow our campus to bring some of the very best oncologists, radiation oncologists, cancer surgeons. We've been able to recruit a very good group of new surgeons to our campus because they just knew this was coming. And these are going to be the same caliber people who would fill a job in Houston at MD Anderson. And to be able to recruit that kind of skilled individual, not only to the clinical side, but to our research, to our public health activities, to our primary care and behavioral health areas, our lung area, our pulmonary area, because they are going to be associated with an Anderson. That kind of recruitment power is going to pay off for this community in just so many ways.
Let's wrap this up with this last question. Aspirationally, 5 years from now, where do you see all of this being? How will cancer treatment be different, and how do you see this cancer center 5 years from now?
We frequently say in our leadership meetings when we're trying to make decisions, we frequently will stop in the middle and say, wait a minute. What we believe, what is our culture, is that everything we do, we want to do through the lens of community need. And let's go back to that. We got back into cancer in a significant way because we felt there was a community need. And so the proof in the pudding will be not just how this campus improves with additional faculty and personnel and buildings and so forth. That sort of thing generally comes to academic medical centers. For me, the real proof in the pudding is, are we impacting our community in a positive way? So with respect to cancer, are we seeing our cancer rates go down? Are we making better diagnoses? Are we fulfilling our academic mission and training new cancer doctors? We train our competition. We know the cancer doctors who will be trained here are going to go work in other hospitals. We do that in primary care and so many other areas. I mean, that's what an academic medical center does. And we put on conferences. We had a huge conference here last week, and we invited physicians in the community to come and here at an academic medical center, sort of touch base again with their training and, pick up again on what now are the latest techniques. That's what we do. So the real measure, the real change 5 years from now is if cancer care across our entire region has been elevated because of this effort, cancer rates are coming down, patients who do develop cancer, their survivorship is going up, okay, that the quality of life of cancer survivors is improving, and if the reputation of UT Health Northeast is one of respect and affection in this community because of the things we do, that's the goal that I'm really seeking.
Doctor, fascinating time together, and we thank you so much.
Thank you. It's been fun.